Hey guys, in this chapter we're going to be going over Chapter 46, EMS Response to Terrorism Involving Weapons of Mass Destruction. In this chapter we'll go over exactly what weapons of mass destruction, or WMDs, are, pre-hospital response to these kind of incidences. We'll also go over conventional explosives and incendiary devices, chemical and biological agents, as well as nuclear weapons, as well as radiation. We'll also go over how you can protect yourself, as well as decontamination, what to do in the event of active shooter incidences, and as well as how to protect yourself from cyber terrorism. Weapons of mass destruction is something that we must always be prepared to respond to. Us specifically in the southeast area of Alabama, we do have military installations in the area that are targets, such as Fort Rucker. You have Eglin Air Force Base. You have there's Fort Walton. You have Maxwell Air Force Base up in Montgomery, as well as various other smaller bases and posts around the area. Weapons of mass destruction includes anything ranging from chemical, biological, nuclear explosives, as well as incendiary devices, as well as unconventional weaponry. WMDs are designed to cause widespread destruction as well as widespread death. The mnemonics CBRNE and Be Nice are used to help remember the types of weapons of mass destructions that we may see. CBRNE is a mnemonic that is used to help remember the WMDs or agents that may be employed in a terrorist attack. C being chemical, B biological, R radiological, N nuclear, and E explosive. Be Nice is another one used to help remember. B is biological, N nuclear, radiological, I incendiary, C chemical, and E explosive. Ultimately, it just depends on which one you prefer, which one you're able to remember to. Dissemination can take many forms with widely varying results. For example, a small amount of a chemical agent could potentially kill hundreds or thousands of people if it's spread over a densely populated area, with minimal or no physical damage suffered to the structures in that area. Oops, excuse me, sorry. I hit the wrong button. You also want to, how long do the effects of various weapons and agents last? It depends. With a chemical agent, it could last, as long as the chemical is active. For a nuclear attack, it could be years. How harmful are the various types of weapons and agents, and how likely are they to be used? Some it's not very likely for them to be used, such as anthrax or other biological agents are very unlikely to be used because of how hard it is to properly construct it. Detection of weapon of mass destructions is also a challenge. Definitely in some of your smaller areas, they don't have the same detection capabilities as such cities such as New York City, Washington, D.C., where they may have equipment brought out or put out to even be able to detect biological compounds that might be floating in the air. How do you think that we might be able to prepare for an attack, or an attack with weapons of mass destruction? Right, by practicing, by having drills. That's why we do drills on a consistent basis. It's not just that they are giving us something to do. They are actually doing this to prepare in the event something would actually happen. With supplies and equipment, you want to make sure that you have enough equipment to handle a situation in your area, as well as to respond for it. And it's not just within a city; it's within an entire community. And I'm going to keep bouncing to Fort Rucker since it's right here. In the event something would happen on Rucker, you've got Ozark who could respond. You have Enterprise, Delville, Dothan, Troy, just in the immediate area. Um, as well as the type of device used requires specific equipment and supplies necessary for it. You want to make sure that you have the proper PPE. The PPE for a chemical attack or a biological attack may not be the correct one for a nuclear attack. You want to make sure that you have a plan set up and prepared in the event this would happen to allow for rapid deployment of all necessary resources. It's unrealistic to think that a single agency has the equipment rather to manage a terrorist incident. So that's why it's important to establish that community response to a disaster. For example, the World Trade Center was attacked. You had not only NYFD, but you had Boston that responded. You had all the various suburbs and smaller cities in the area that all responded to assist when the Trade Center was attacked. You also want to make sure that there's a plan to establish medical control for the event, and also to verify credentials of all responders from outside areas. If someone comes in to help out from Mobile, how am I going to verify it? Well, I want to check their license. I can verify it with ADPH if pending I have communications available. So you also want to make sure that you have communications. And if you are, sometimes it may be unreliable, definitely if you're relying off cell phones, because everyone's going to be calling. So it may take you a while to get phone calls through. So medical direction may have, based off of the policies that were established, they may make all protocols standing orders in a case involving weapons of mass destruction. That's why it's important to know what your policy states. As always, when you prepare yourself, always keep in mind of your safety. For patient care, you must be aware of the various agents that could potentially be used as weapons of mass destruction, as well as the signs and symptoms of the conditions that results from that exposure. When responding to a scene, the earlier an incident can be recognized, the better. The earlier that you recognize that this is a mass destruction incident, the quicker we can get command and everyone involved in response. You also be wary of the possibility of secondary explosions when conventional weapons are used, i.e. Boston Marathon. They had the primary explosive, and then once everybody started moving, they let off a secondary explosion as well. Chemical and biological weapons present a danger that is much more difficult to recognize and identify as compared to a nuclear or conventional blast. Chemical weapons can release gases or aerosols that are only recognized upon exposure or shortly thereafter. If numerous patients present with similar signs and symptoms with an unexplainable or unidentifiable cause, a chemical or biological weapon should be expected. Signs of a toxic and unsafe environment may include respiratory distress, burning to the chest or eyes because of them breathing in the fumes, cough, and dyspnea. If excessive salivation, loss of bowel and bladder control, and tearing are noted, suspect a serious chemical exposure. Inspect the scene for dead or incapacitated animals or insects. Odors of bitter almond, peaches, mustard, garlic, onions, or fresh-cut grass or hay could also be a strong indication of deadly chemical weapons, specifically when that smell shouldn't be present. Whenever possible, all responders should enter the scene from a single staging or mobilization point to maintain scene security. An escape plan should also be determined and communicated to all responders on the scene, with a pre-designated responder collection point. Also, when taking scene safety into consideration, you should always approach from the upwind side, so that way all potential fumes are being blown away from you. Only enter a scene with specialized training and protection, specifically confined spaces. And before doing any transport, let somebody know. Let command know. Let your transport unit supervisor or transport unit leader know that you're transporting a patient, so that way they're aware of where everybody is at. When you arrive to a scene, of a terrorist incident as an EMT, regardless of your role, the overall goal is ensuring that the most good is done for the most people. Um, you're first on scene. You will establish incident command and start doing a scene size up. As more personnel come up, you may turn over command and now you become a section leader or a section officer, such as within triage, treatment, or transportation. Utilize triage principles when faced with challenging decisions. Patients must be protected from harm, informed of your actions, and cared for to the best of your ability, despite this being a difficult situation. As evidence, the dead must be disturbed as little as possible from their original location. Included in this is not disturbing their clothing, which can further help investigators. It also cannot be discounted that among the injured or deceased are the actual perpetrators of the terrorist incident. If you work in an area that is a large metropolitan area, you want to recognize these locations as potential targets. If you go to events, these may be potential targets. Even events that you wouldn't think of, i.e. the event that happened in, was it Vegas? Yeah, the Vegas incident with the shooter that was shooting out of the hotel. Explosives work by using various chemicals whose primary characteristic is to burn extremely rapidly when exposed to certain stimuli, causing very hot gases to displace air in a very violent fashion, creating a shock wave or a blast. This is referred to as the detonation or deflagration. With explosives, the blast does move out in all directions at very supersonic speeds, causing blast injuries. So even if the patient may not have a burns or actual secondary injuries, they may still have injuries to their hollow organs or to their eardrums due to that shock wave. An IED, or improvised explosive device, is defined as an explosive device constructed from homemade or readily available materials that's used to kill, incapacitate, distract, or harass a specific target. These can be used with multiple different things. They may be packed with multiple different things, such as pens, rocks, shrapnel, whatever they want, whatever they can get their hands on. A VBIED is a vehicle-borne IED, and usually commonly used as an explosive known as ammonia, nitrate, and fuel oil, and these will be commonly placed in either a car or truck. Some common compounds that you might see used as explosives. EGDN is ethylene glycol dinitrate, or dynamite. Hexamethylene triperoxide diamine, which is a highly explosive peroxide. PETN is pentaerythritol tetranitrate, which is the main ingredients of Semtex. RDX, or cyclonate cyclotrimethylene nitrinitramine, which is another ingredient for Semtex. Semtex, which is a plastic explosive made of both PETN and RDX. PETN and RDX can be used separately, or they can be put together to create Semtex. TATP is acetone peroxide, which is a primary high explosive and organic peroxide. Within an explosive, you have primary, secondary, tertiary, quaternary, and quinary effects. Your explosion or the blast wave is your primary effect. The secondary effects is from the flying debris that may have been thrown up due to the blast wave or any shrapnel. Tertiary effects is caused by the displacement of the body as they get displaced from where they were standing and they fly against a wall. Quaternary effects is from secondary burns, building collapsing down on them, or any inhalation injuries. Quinary effects results from environmental exposures as to bacteria, chemicals, radiation, fuels, and metals. The World Trade Center attack produced primarily quaternary and quinary injuries from the fire, building collapse, and exposure to toxic contaminants. So even patients that were not involved, or people that were not inside the World Trade Center who died when it collapsed, those that were running away from it, were subject to quaternary and quinary injuries. Types of injuries that we might see within the lungs, due to the blast wave, it can cause pneumothorax. Due to the gases, fire, um, so the anxiety also can cause the blood pressure to go up. You might want to look for altered mental status, bloody sputum, chest pain, as well as stroke-like signs and symptoms. Use caution when using positive pressure ventilation to avoid causing a patient to develop an air emboli or tension pneumothorax. Within an abdomen, the bowels, the hollow organs may bleed or leak contents within the abdomen. You may also have an evisceration. If your patient has an evisceration, you want to make sure that you manage it properly and transport that patient rapidly. Also, due to the blast wave, you may have damage to the ears. The eardrum itself may rupture. The patient may have hearing loss, and the inner ear bones that are very fragile may be disrupted as well. Due to structural collapse, you may have crush-type injuries. The weight of the debris on the patient can create excessive compression forces, causing crush syndrome. In addition, the structural collapse can inflict direct, blunt, and penetrating injury, whereas dust and smoke can cause respiratory and eye injuries. Crush syndrome is associated with entrapment for 4 hours or more. The crushed tissue can produce harmful byproducts. After the pressure to the crushed area is relieved, the accumulated byproducts are then released into the systemic circulation, causing serious problems to the patient. You may also have shrapnel injuries. Each person can experience a different effect from the missile, which would be the shrapnel. Solid organ tissues are rapidly compressed and stretched. Contents of ruptured hollow organs can leak out into the surrounding cavities. Connective tissue injuries are frequently limited to the shrapnel pathway because of the resiliency. Bones can fracture also when struck by shrapnel. Incendiary devices, these primarily cause burns. With these, you want to be cautious for secondary devices as well as devices that may not have detonated yet. Hypergolic substances are chemicals that spontaneously ignite when they encounter one another without the need for an ignition source. An example of such a combination of chemicals are pool chemicals that, upon contact with high automobile fluids, spontaneously ignite. Hypergolic substances are often used as incendiary chemicals by terrorists because of their wide availability. Chemical agents in the form of aerosolized liquids or solids, vapor, or gas can enter the body through the respiratory tract, skin, and eyes. Entry through the lungs is by far the most critical because a large quantity of chemicals can be absorbed and dispersed throughout the body by this route, causing severe systemic effects. Liquid agents are primarily absorbed through the skin and eyes. These can cause severe localized effects such as chemical burns and serious systemic effects if absorbed long enough. Accidental ingestion of chemical agents in contaminated food is possible, yet rare, pending they cook the food properly. If the agents do not evaporate, they are considered persistent. If they do evaporate and they are creating vapors, they are considered volatile. Now, this obviously also depends on the temperature. If they have a high volatility, that means there has to be a certain temperature for it in order to evaporate. There are various types of chemical agents out there, such as nerve agents, vesicant, cyanide, pulmonary agents, riot control agents, and toxic industrial chemicals. Nerve agents are very potent. These block an enzyme that blocks the enzyme that breaks down acetylcholine, which is a neurotransmitter, allowing accumulation of ACH in that area. This causes an overstimulation of the muscles and nerves as a result. Give me 1 second. Table 46-1 goes over various nerve agents that we may see. These agents are the deadliest known chemicals. Agents such as tabun, sarin gas, VX gas, and Novichok agents. 46-2 goes over signs and symptoms of nerve agent exposure. The larger the dose with direct respiratory inhalation of the nerve agent vapor, the quicker the onset and severity of the effects. If it's a vapor, if it's a small exposure, they may just have runny nose and mild dyspnea. Whereas a large exposure, they may go suddenly unresponsive and have seizures. With liquid, with small exposure, they may have localized sweating and nausea. Whereas large exposure, they may have the seizures, apnea, paralysis, and as well as copious secretions. The patient may also be in respiratory distress or respiratory arrest. They may drool or have a large amount of secretions within the oropharynx. You may also hear wheezing on auscultation of the lungs if they move air on respiration. Other signs and symptoms include meiosis or pinpoint pupils, rhinorrhea or runny nose, excessive salivation, tearing in the eyes, blurry vision, nausea and vomiting, diarrhea, sweating, and loss of bladder control. We use the mnemonic sludge to help remember these signs and symptoms. Sludge standing for salivation, lacrimation, urination, defecation, gastric distress, and emesis to help remember these signs and symptoms. Any wounds that you might come across when dealing with a nerve agent patient should be covered quickly to prevent further contamination and absorption of the nerve agent. Keep the patient warm and transport them as soon as possible. You want to make sure that you monitor your ABCs and be ready to suction. If you have it, you may also administer atropine and pralidoxime. These are antidotes. To combat any seizures, some type of benzodiazepine, such as diazepam, lorazepam, or midazolam, should be used. Vesicants are another group of chemical agents that results in damage to exposed skin, lungs, and eyes. If a significant amount of a vesicant is absorbed, they can also produce systemic effects, including generalized illness. Vesicants can cause blistering, burning, and tissue damage to the affected areas. And these examples of vesicants include sulfur and nitrogen mustards, leucide, and phosgene oxime. Signs and symptoms include burning, blistering, necrosis, stinging, tearing, and development of ulcers within the eyes, dyspnea, pulmonary edema, nausea and vomiting, and fatigue. Patients that are exposed to vesicants, it could potentially take up to 2 to 24 hours before they produce signs and symptoms, specifically with mustard gas. Eye damage can occur within 1 to 2 hours after exposure. Most important emergency care that can be provided for vesicant exposure is immediate irrigation. Treatment during the first few minutes after exposure is crucial to preventing damage. Irrigate with water or a chemical decontamination kit. Any chemical burns, you want to manage them appropriately by applying a dry sterile dressing. If the patient has been exposed to leucide, which is an arsenic-based agent, you want to give the patient dimercapol, which is the antidote. Cyanide, this disrupts the ability for cells to use oxygen. With high doses, death can occur within 6 to 8 minutes. Even moderate exposure can lead to death. Low-dose exposures can lead to illness, but the patient would most likely recover. If you've ever watched an old-timey spy movie, even those made today, definitely the ones that were based out of World War II, and it's actually true, they actually did this. They may, if you've ever seen them, what looks like pop their tooth or swallow something, that's actually cyanide that they are ingesting to commit suicide. Signs and symptoms of cyanide exposure include anxiety, tachycardia and tachypnea, seizures, unresponsiveness, pale, cyanotic, or even normal color skin. Low concentrations of exposure cause mild signs and symptoms, as well as a slow rate of onset. Exposure, emergency treatment, obviously managing your ABCs. You may have to provide an antidote to save the patient. It consists of a nitrite such as amyl nitrate or sodium nitrite, as well as sodium trisulfate. Some systems only use trisulfate as an initial treatment due to cost. Pulmonary agents, these include phosgene or other halogen compounds. These act primarily to cause lung type injuries. Relatively small concentrations of phosgene mostly irritates just the mucous membranes of the mouth, eyes, nose, and throat. Initial signs and symptoms can reflect this irritation, however. Pulmonary edema can take up to several hours to develop after exposure. Other signs and symptoms include throat irritation, dyspnea, cough, crackles due to fluid entering the lungs, stridor due to upper airway swelling. Care for these patients include managing ABCs, as well as being prepared to suction and administer oxygen. Tracheal intubation may be needed if airway obstruction is evident, thus activating ALS response for advanced airway care. Riot control agents, these would be tear gas, CS spray, pepper spray. Terrorists may expose persons to these agents but report them as being exposed to nerve agents to cause greater fear and panic. To determine whether such a hoax is occurring, you should keep in mind the differential diagnosis that nerve agent exposure results in the hallmark sign of meiosis, or excessive constriction of the pupil, whereas exposure to tear gas or pepper spray does not. Emergency care is mostly supportive for these patients and may include irrigation of the eyes. Toxic industrial chemicals, these could be obtained from hijacking rail or truck transportation of chemicals or sabotage of chemical plants. Treatment depends on the agent involved. The effects of an emergency care for industrial chemicals are as diverse as the chemicals. Many of the more potent chemicals behave like pulmonary agents. That is, they primarily attack the respiratory tract. Examples include phosgene and methyl isocyanate. These chemicals actually killed thousands of people in India. Alright guys, we're going to take a break here. Stretch your legs, go to the restroom, get something to drink if you need to, and we will pick up with biological agents.